Dr. Eric Weiss. It's a pleasure to have you on the podcast. Dr. Eric Weiss is a leader in advanced regenerative medicine and co author of Educating Marston, a memoir about his family's journey to improve life for his son on the autism spectrum. He's the founder of North Florida Stem Cell Clinic, where he provides stem cell replacement therapy for various conditions with a focus on autism related symptoms. A graduate of Duke University's medical school, he completed general surgery training in the University of California system and reconstructive surgery at the University of Miami. And he's board certified in plastic and reconstructive surgery. Doctor, first and foremost, I generally ask people how they got started down this path, but it seems like this is more of a personal pursuit of yours rather than just a professional. So if you could tell me about how you found yourself with a career focused on autism.
Well, I think, if you would have told me even just 5 or 6 years ago that I wouldn't be doing plastic and reconstructive surgery, I would have told you were crazy. I was a very busy plastic surgeon, had a great practice doing all sorts of things. But, my life, I guess, really changed when my son, Marston, who's now 30, was diagnosed with autism. And then obviously as a parent of an autistic child, my wife and I did everything. Her job was to find the therapy. My goal was to kind of vet it and, did it work? Does it have a scientific basis? Um, and then, do we keep going with it or do we switch to something else after a few months? But most people don't realize that in 2005, as the incidence of autism was starting to increase dramatically, John Hopkins, Harvard, and University of Miami collaborate on a study looking at fresh brain specimens of kids with autism, who died of other causes,
Mm,
drowning, house fire, car accidents, etc. And every single one of the people they looked at had brain inflammation, a very specific type of cell called the glial cell in the brain. And this was the first time that there was ever a pathologic, anatomic finding of autistic brains that was different. And then they backed that up on living kids by doing cerebral spinal fluid studies. And they found the same thing, all these inflammatory markers. And then life just,
mm.
kind of, they published it in 2005 and nothing happened. And then I don't know if you remember in 2008 and 2009, when the NFL players were getting chronic traumatic encephalopathy, and everybody was trying to figure out why these football players could get a concussion or even a subconcussive blow. And then 20 years later, be 30 times more likely to have dementia. Well, the people that were looking at CTE found out that they indeed had uh, glial cell inflammation as well. So kind of the same findings as you found in autism. But they started a study. They had 30 trials looking for something that could turn off glial cell inflammation, and they found umbilical cord blood in its stem cells. It is
Mm.
the only thing that's been able to show to turn off brain inflammation and turn on brain restoration, actually new connections and new cells. So I treated my son, and that kicked off what I'm doing now.
I want to talk about the double-edged sword of the medical industry. A lot of people who are suffering from chronic illness or other illnesses who are using just limited tools at their disposal to solve problems often feel like they're hindered from using greater technologies, more cutting edge tools that are still in the experimental phase due to ethical standards. Now, stem cells is particularly a fairly interesting conversation in this domain. And my first question to you, how do you feel the framework for for using stem cells for research for treatments is in this current environment in the United States?
Well, it is difficult. We have an FDA here, and that regulates drug companies. The average length of time from discovery to FDA approval is 17 years.
Mm,
So there's a huge, lag time between these innovations and using them. And usually there's a lot of clinical data. Now, with stem cells, most people don't realize that umbilical cord blood and its stem cells have been used medically in the United States for 60 years. There's 80 different diseases that it treats. And luckily for me, the FDA regulates drug companies. It doesn't regulate healthcare. Healthcare takes place between me and my patients. And so once a product is on the US formulary, if I and the patient are the patient's guardians, believe it's safe and potentially beneficial, then we can use it off label. And that's how I do. I use it off label. 20% of all medications in the
Mm,
United States are used off label. But to the broader point, these cells have the ability to seek out inflammation and correct it. And almost all the chronic medical conditions are inflammatory based. And so I think as this gets rolling, this will be the biggest innovation in medicine since antibiotics that will have the ability
fascinating.
to treat chronic illness.
So, what's particularly interesting about umbilical stem cells? Why not something that's pluripotent, maybe embryonic stem cells, or perhaps, if you could talk about even like induced pluripotent stem cells, Yamanaka cells, what the future might lie in store for those?
Oh, I think that might be the Mount Everest that's getting climbed right now. Obviously, if you can take your own stem cells and then move it backwards to an induced pluripotent cell and then give it back to yourself, then there's no, risk of rejection or something like that. Um, there is a difference between embryonic stem cells and what we call adult stem cells. Embryonic stem cells are designed to make something, a heart, a liver, a kidney, a structural thing. Embryonic cells make babies. However, adult cells are designed to heal. And so
Mhm.
when about midway through the second trimester, the embryo is already formed, the fetus is formed. And so the cells switch from being embryonic to being adult. So even when a child is born, these are adult stem cells with their ability to seek out inflammation and correct it, actually turn on the body's own healing mechanism. So I describe um, umbilical cord blood as chicken soup for healing. There's 6 different types of stem cells, as well as something called natural killer cells, as well as tremendous amounts of T regulatory cells, which help suppress inflammation as well. The FDA doesn't allow us to separate out the cells. It has to be something called minimally manipulated tissue. So even though there are stem cells for the blood vessel and heart, stem cells for the GI tract, multiple stem cells for the brain, you can't kind of pick and choose. You just have to give the chicken soup, so to speak.
Interesting. So, back to the umbilical stem cells for just a moment. Are there various kinds of umbilical stem cells, and why do you feel those specific types of stem cells are so magical for the problem you're trying to solve?
Um, Obviously, umbilical cord just describes where they come from. So these stem cells we have in our own body. There's some in your bone marrow. There's some in your peripheral fat. Dental pulp is a natural holder of stem cells. Menstrual blood, etc. There's all sorts of places. But the longer these stem cells are in your body, the more they differentiate.
Mhm.
So when they come from the umbilical cord, they're as close to pluripotent as you can get. They do multiple things. And so they've already looked at, like, let's say mesenchymal stem cells that come from a patient's own bone marrow versus mesenchymal stem cells which come from umbilical cord blood. The ability to heal with that MSC from the umbilical cord blood is hundreds, if not thousands of times better than the one that comes from the patient's own body, especially if you're older, because by the time you're through your teenage years, you've lost 90% of your adult stem cells. Mid 30s, 95%, mid 50s, 98.5%. And so these stem cells not only age out, but they lose their healing capacity, which is what we know one of the biggest signs of aging.
Yeah. Talking about inflammation for just a moment, because this will be our segue into aging. So, inflammation seems like it's the killer for everything. And I want to talk about that relationship between inflammation at a cellular level and stuff we do like fasting, like exercise. How is this all related? And how exactly is that relationship between stem cells and doing stuff like fasting?
There's a great paper written by the guys at UCLA um, looking at brain cells, and how they grow. Um, but it's very difficult to get new brain cells when you're adult. There's only 3 things that have been shown to really promote brain growth as an adult: fasting, significant fasting, several days, exercise to exhaustion in these stem cells.
Hmm.
So as our bodies age, they become what we call senescent. They just lose their ability to be vibrant and to fix themselves. And so what happens is, let's say brain cells, for instance, we have something in our cells called the Krebs cycle, and that generates something called ATP, which is the energy that the mitochondria use. And so every turn of the the Krebs cycle when you're young should generate 38 ATP. And that means your cell is just humming along. But the older you get, and I mean, starting at, kind of early 30s, you get a turn of the Krebs cycle, and instead of 38, you get 36. Then you get 34, then you get 30. And the cells become damaged. They become less efficient. They gather inflammation, not enough to kill the cell, but not enough for that cell to be at 100% efficiency. And
Hmm.
so, a quick plug for NAD or NMN, it's been shown that NAD is the precursor for ATP. And so even though your Krebs cycle is inefficient, if you ramp up the precursors, you can get 38 with a single turn, which is,
Right.
the only really supplement I take is NAD, because
Hmm.
losing your energy, losing your mitochondrial efficiency is at the heart of aging. And
Right.
so these are very good.
Yeah, so that's the $1,000,000 question, right? We obviously know we need NAD within our cell, but the question is how we get it in our cell. So you talked about a precursor NMN. What's your opinion on the best way to get that NAD in the cell? Because sometimes taking actual NADs, it can't pass through the cell membrane. It's got to be broken down. So I think the jury's still out whether using
Yeah, no,
NMN,
no,
taking
I
NMN.
think it is too, but I think, you know, if you could do it, IV is a great way, but it takes a long time, and sub Q, I do sub Q, 3 times a week, just because I can do it and be out the door. NMN, I think it should go sublingually, or some type of liposomal derivative so that it can get through the GI tract, better, but sublingual is a direct, into the bloodstream. But while we're on this, one of the cool things about stem cells, and most people don't realize how they work. They work through something called paracrine activity. So when you get umbilical cord blood, these stem cells don't become something in your body. They don't become engrafted. They seek out inflammation and they nestle up to your cell that's damaged, and they secrete things. It's something called a secretome. But one of the things they secrete is called an exosome. And inside that exosomes are fresh new mitochondria. And it secretes it and it fuses with the cell, and it sends in new mitochondria, new proteins, new all sorts of good stuff to really turn the hands of the clock backwards for that cell. And
Hmm.
so one of the best ways for mitochondrial dysfunction is umbilical cord blood and its stem cells.
Interesting. You mentioned fasting for for an extended period of time. So I personally fast myself. I do about 18 hours a day, sometimes 20, but I try to make minimum 18 hours. And you talked about just senescent cells and it's all tied in, but I want to know how long do you recommend fasting to really get those
Um,
aging effects?
I have no interest in any, not, financial interest in anything, but, and I'm blanking on his name, but there's a doctor at UCLA that's been studying fasting forever. And he has tremendous research in the Alzheimer's setting in memory care centers. And so what he did was I'm not speaking for him, but the best way to test fasting is people with memory issues, because you can just tell them they ate, then they go on their way. And so he had all these biologic markers. And he did a long fast, 3 or 4 day fast on these people. And he saw their memory get better, their inflammatory markers go down, tumor size shrank, all this good stuff.
It's very
Then
hard to fast for multiple days, though. Like
right.
the
But
one,
no, but then
yeah.
he asked the question, how much can you eat and get the same benefits as a fast?
Mm.
And he solved that. It's about 400 to 600 calories a day. And what he came up with is called the Prolon fast, Prolon. It comes to you like an iPhone, big white box. It says day 1, day 2, day 3, day 4, day 5. And that's what you eat, that's what you drink, it gives you stuff. And after day 3, I'm telling you, you feel amazing. And so I do
So
that.
hard to get to there. That's the thing about fasting. It's like the first, like even for me, 18 hours, if I eat a little late one day, every day for the next week becomes exponentially more difficult. Once you're
Right.
set in motion on a schedule, it is so easy and it's so enjoyable. And then the second you deviate from it, it is so difficult to get back on board.
Right, right. I went to 1 meal a day probably 10 years ago. So I have a hot tea in the morning, I have a hot tea, and maybe a protein bar at lunch, and I eat dinner. And I do
Love it.
that. But if you get off on the weekend, you go out to dinner, you do something crazy.
Messes everything up.
Exactly. You're
It's
done
not
for
worth it. It's not worth it. It's not worth it.
right. So you have to pick. But I actually talk to patients, and I think one of the big uses of this GLP-1 will be in people of normal weight who want to do a 1 week fast, because it takes that hunger
Mm.
pain away. And that's kind of the biggest problem with it is the GLP-1s actually prove to you it's what you eat because all it does is take away the hunger pain. And so what you have to do is if you want to lose 30, 40, 50, 60 pounds, is realize that it's all about what you eat one time a day, eat a small meal, and then you won't rebound after you're off it. But I think that the average person who would wanna do a fast for just health reasons, could do it, you know, do a 1 week, GLP for, twice a year,
Hmm.
because
Fascinating.
it decreases your risk of malignancy. It decreases your risk of diabetes. It wipes out inflammation. Senescent cells die off. So there's tremendous, possibilities with it. But I think that's, really unexplored by a lot of people, you
Yeah.
know, who are a normal weight. It could benefit from fasting, but it's so difficult to do.
Yeah. I see it as we're really moving forward quickly with breakthroughs like CRISPR, with the advancement of AI that can start to calculate millions of permutations to create ideal protein and molecular structures for solving all sorts of diseases. We're heading into a world of quantum computing. We're heading into a world where data is just so much more efficient with blockchain. I would call it a Cambrian explosion of knowledge ahead. And I look at it as doing the best you can to keep your body healthy for the longest point possible so that you could be privy to a really beautiful future that's ahead. So,
No, no, I agree. I think that, the whole goal of life is to live healthy and then drop dead. So, nobody wants to be in a wheelchair. Nobody wants to be on oxygen, but we're fighting human nature. People eat too much, they smoke, they don't exercise, they gain weight. And so sometimes it doesn't matter what the knowledge is. Um, the- but, the more you educate people and hopefully, you start treating, um, it's crazy. We don't learn about nutrition starting in first grade,
yeah,
the high, fructose corn syrup and the things they add to food, which make you forage like a bear. They keep you, they don't turn your satiety center off. You just keep eating and eating and eating.
yeah.
And so all that needs to be fixed.
The obesity epidemic is really hard for any person to wrap their head around. And the worst part about this process is that these values are instilled in childhood, where it's normal to give cereal to a kid every single day. This is just how things work. And I think it's even a degree of freedom deeper, where you have this false illusion where you feel like you're eating healthy. You're like, oh, I had yogurt, I ate healthy, so I can treat myself. But you don't realize you've just eaten 30 grams of sugar in that yogurt. And this circles right back to inflammation. I live my life like I'm diabetic. I shop at the diabetic section when I go to the grocery store,
Right.
right? And I think the best way to avoid becoming diabetic, because I think diabetes is really the absolute silent killer. It opens the door to a bunch of chronic illness. And once you have diabetes, it's really an uphill battle staying alive.
I th- I tell my patients, if somebody didn't kill it or you can't wash it, you shouldn't eat it. And so it really starts to narrow the field of like fruits, vegetables, and proteins.
Yeah.
And get your carbs through, your oranges, your lemons, your limes, your strawberries, and not through, Twinkies, so to speak.
Yeah. I want to pull this back to autism for just a moment. So, tell me a little bit about how you view autism in general and how you're approaching this specifically with stem cells.
Okay, well, I truly believe autism is a medical problem. It's not a behavior or psychological problem. These kids and adults have dysregulated immune systems. Like I alluded before, they have brain inflammation, and it's a very specific cell. It's a glial cell. And the glial cell in the brain is the only cell in the brain that doesn't come from neural origin. It actually comes from the bone marrow. And it has to do with organizing neurons, clipping neurons, making some neurons talk. And when these cells are inflamed, they snip connections. So autistic people lose connections, and they cause neurons to die off sooner. Um,
Hmm.
and that's one thing with autistic kids. The second thing is they have all these autoimmune issues. Uh, Leucovorin, which is folinic acid, is in the news now because there's something called a folate receptor antibody. 80% of autistic kids will have a folate receptor antibody, which blocks folate getting into the brain. And folate is vitamin B9. It's absolutely necessary for normal brain health and normal brain function. And when you give kids
Hmm.
folinic acid, which is like the first cousin to folate, it gets into the cell through a different mechanism. But once in the brain, it gets converted to folate, and so then everything's good. Tremendous benefits in talking, and now there's double-blinded, randomized, placebo-controlled trials showing that leucovorin helps kids, with autism. And then the last thing
Fascinating.
here, go ahead.
That's fascinating. Can you talk about the a little more about the study and
Yeah. Oh, and so I don't know, but I'm a little older than you. I can tell. I'm a doctor. When I was young, we had March of Dimes walk with March of Dimes, and they always showed a kid in a wheelchair, and that's because the kid had spina bifida. And spina bifida is when you were born and the spine wasn't closed. And these kids were paralyzed, had bowel and bladder issues. Uh, that was found out to be a maternal folate or a maternal vitamin B9 deficiency. So all these prenatal vitamins, that's all kind of new, and they're just filled with folate and folic acid. And that spina bifida has kind of fallen off the wayside because hardly anybody is folate deficient. Well, it turns out that there's something called a cerebral folate deficiency. There's a famous Dr. Fry who kind of put it all together. And he's the one that showed autistic kids don't have folate in the brain. And he took their spinal fluids out and showed that they were folate deficient and they started to get better. Then the question is, well, how come their blood levels have normal folates, a normal
hmm,
folate level, but at a cellular level, there is no folate. And they figured out that the folate couldn't get into the cell. And when they figured out how to get around it, and once again, a repurposed drug, this drug leucovorin, is used in chemotherapy, women with breast cancer, but it's a way to get folate into a cell. So they did a trial. There's now been 4 or 5 of them that have all showed tremendous benefit uh,
interesting.
with autistic kids by notably speaking, actually, but in all facets, socialization and repetitive behaviors getting better.
But my question is, getting folate into the cell now, would that solve the issue, or is it something where it's like it's already been structured in a way that there's an issue?
Well, that's a great question because these are all new studies. And so, people are just taking, you know, f- uh, folinic acid for the first time. Um, Now, there are people that were profoundly autistic that of getting, much better. I mean, like from being completely nonverbal to becoming completely
How do you quantify that?
there's autistic rating scales. There's about
Okay.
6 major ones. And so they get tested, every 2 to 3 months. But it's and nowadays with cell phones, it's very easy because they have videos of their kids at 4, 5, and 6 not talking, and then at 7, 8, and 9 speaking normally, and all
Oh,
they've
wow.
had was leucovorin.
Super interesting. I've never viewed autism in the spectrum as a disease, so that's just really
Right.
it's a monumental shift in perspective, and that's sometimes like the most important step forward to change how
Right,
you view the
exactly.
problem.
Then there's great research out of Arizona State University. Most people don't realize or know that 80% of kids with autism have gut issues. They have tremendous gut issues, diarrhea,
Hmm.
constipation, bloating, things like that. And there's now been shown through three separate mechanisms how the gut affects the brain. And so almost everybody knows that yeast, ferments sugar into alcohol. We drink our beer, our wine, and our whiskey, but ethanol is truly a brain toxin. And so these kids have yeast overgrowth in their guts, and it's fermenting sugar. But they also have many other abnormal bacteria, and one of the
Mm.
bacteria makes a chemical called paracresol. And paracresol is a known brain toxin, and it causes brain inflammation. And through a beautiful experiment, these people at Arizona State took the stool out of kids with autism that had high paracresol levels, put them into laboratory animals, and the laboratory animals started to act autistic. They withdrew socially, they stopped communicating, they started repetitive behavior. Then they gave antibiotics uh, to treat that bacteria that makes paracresol, and these laboratory animals got better. And so they now have their first study of 18 autistic children where they did a process called FMT, where not only did they give them antibiotics, but they gave them new gut bacteria. And at 2 years with no other treatment, about 47% of the autistic symptoms are gone just by treating the gut.
Wow.
And
That's
so,
crazy.
right. And so what I do in my practice is I treat the gut, I give leucovorin, and I treat with stem cells. And so I'm attacking the brain with the stem cells, the brain inflammation. I'm giving the brain the nutrients it needs through the folinic acid or leucovorin. And then any ongoing inflammation that can be potentially coming from the gut, I take care of as well.
So interesting. So you mentioned just stem cells and brain inflammation. I'm curious, is there a pathway here to use stem cells to treat diseases like Alzheimer's, dementia, and supranuclear palsy, PSP, or even just regular palsy?
Without a doubt, the classic kind of brain inflammation autoimmune disease is multiple sclerosis. I have two patients that were wheelchair bound, and after a single treatment, within 2 months, they were walking. And,
Hmm.
one is 3 years out from a single treatment, and she's still walking, and the other's about a year and a half out, and he's still walking. Um, uh, Lomacel B is a stem cell product that is being looked at UCLA, and they've given it to Alzheimer's patients. And at 3 months through MRI, the inflammatory markers have started to go away. The amyloid plaque started going away. The neurofibrillary tangles started to go away, and their brain started to grow. And one of the
Hmm.
hallmarks of autism is or not autism, of Alzheimer's, is the brain shrink because they lose so many cells. So at
Hmm.
3 months, they're starting to show radiographic evidence of the reversal of Alzheimer's. However, um, the dementia didn't change, but these were people that were very well gone. So if you look at the top neurodegenerative disorders, Alzheimer's, Parkinson's, ALS, traumatic brain injury, chronic traumatic encephalopathy, um, yeah, autism, they're all inflammatory based.
In the context of supranuclear palsy, PSP, is there any science there to your
PSP,
knowledge?
not to my knowledge, um, that's like the, redheaded stepchild of Parkinson's, uh, it, it's so, it's being looked at, but it's not one of the top, ones, but almost all these neurodegenerative disorders at their very base start off with brain inflammation. And
Right.
so I think if caught early, you could potentially treat it. The one thing we do know about this product is it does no harm. There's no long-term side effects. Because as I alluded
Hmm.
to before, these cells don't stay long-term in your body. And when the cells come from umbilical cord blood, they lack something called HLA markers. And HLA markers are the little surface markers on all of our cells which determine self. So when you get a kidney transplant or a liver transplant, it has to be matched. Well,
Right.
these stem cells don't have those proteins to be matched. So they're
Yeah.
generic. They can go into anybody. But the more they work, the more they make these markers, and then the body clears them. So they go in, they do their job, they go away. which
Interesting.
makes them very safe and, um, and no long-term side
Right.
effects.
So the rejection rate for like umbilical stem cells are just much, much lower, I would imagine.
Correct, correct. In some cases, in a lot of cases, we want them to become engrafted. Let's say leukemia, and you've wiped out a kid's bone marrow with chemotherapy, and you want the stem cells to grow new bone marrow. Well, then you have to put him on immunosuppression so his body doesn't attack these cells. But for somebody that has autism or something like that, we want these cells cleared. They'll
Right.
go in, they'll treat brain inflammation. And so um, the natural history, like if you look at the Duke study on autism, is after a single infusion, the kids did a tremendous, benefit, but it plateaued at 6 months. And they assumed that's when the stem cells went away. But they followed these
Mm.
kids for an additional 12 and they never went back down. It was a quantum leap forward. Um, and so the question is, give it again, and you'll see another quantum leap, then another time, and just stair step up towards normal. But it's pretty impressive stuff.
This seems really like the science is at its infancy here. If you had to project over the next decade, where do you see the science taking us?
I like I said, I think this will be the biggest advancement since antibiotics. I think
Mhm.
that you'll be able to inject mesenchymal stem cells, which are found in umbilical cord blood, but also in something called Wharton's jelly, which is the lining of the umbilical cord. It's been shown in horses and pigs you can regrow articular cartilage. So I think the orthopedic surgeons better get on board because I think you'll be a 50-year-old, and when your knee starts to creak, you'll get a single injection, and it'll be like you're 25 again. And I
Mhm.
think that can go in the hip, the shoulder, the knee. I think the anti-aging and just, living healthy. I don't necessarily think these things will extend life, but I think it'll make life worth living as you age, and you'll be able to
Mm.
to travel and walk and exercise, and really, really defeat the hallmarks of aging.
Yeah, I want to tap into a little bit more of a philosophical perspective here. So maybe getting back to the Yamanaka induced pluripotent stem cells and all the regulations that the FDA has around them that make them a little hard to use and leverage for medical treatments, perhaps for good reasons. Sometimes the regulations and protocols really do give us an unfair uh, hindrance in the competitive landscape where countries that don't have regulations get to really explore these options better than we do. What can the future look like where a lot of these stem cells can be leveraged for perhaps bad actors and
Yeah, yeah. Well, obviously, having no regulations is not good because the donors have to be really screened, because you can pass on infectious disease from hepatitis to HIV and all
right.
sorts of stuff. And so the product has to be safe. So you need some regulation. Um, however, we do want to be a leader. We don't want everybody going to Panama or Mexico or anywhere else to get their stem cells. But I don't know if you know, in Florida, they passed a law, a state law that allows stem cells to be given for wound care, orthopedics, and chronic pain, even though it's not FDA approved for any of those three. So the
Mhm.
the the Florida state legislator and governor want Florida to be a leader in stem cell research and stem cells. And so I think it's coming. I think we have the Trump administration and certainly RFK believes in their capability and to be honest, this is not big pharma. This is something God made. And this is how we were designed to heal. And to tap into that potential, to tap into the ability to make the body heal itself, I think is unbelievable.
Looking back from your transition from plastic surgery to the world of stem cells, what was your greatest revelation or epiphany in the process of being like, hey, I've made the right decision, or hey, maybe I haven't made the right decision?
Uh, Talking to these moms, seeing these kids that, I can tell you kids that were not potty trained became potty trained. I've had kids go from special needs schools to regular schools. I had a 42-year-old man who still was in diapers, who now is potty trained and starting to talk. And his
Right.
father told me, that now he can leave him with his brothers. He hasn't had a vacation because he doesn't feel like he could leave his 42-year-old son, with somebody to take care of. It was definitely the right thing. There's a plastic surgeon on every corner. I still miss it some days, but obviously, you know, I'm a little bit unique because not many people are doing stem cells, and certainly not for the autism and other neurodegenerative disorders.
Doctor, how can people get in touch with you?
The best way is northfloridastemcells.com, is the website. You can fill out, there's a patient portal and, we'll get a hold of you and I'll give you a phone call. We'll do a Zoom call and talk you through it or talk to the parents about their child and, get some of this testing that we look at and I talk to them just like I talk to you. I don't want, I want to be a doctor and I want to be a healer. I don't want to be just a nameless guy and you come to the clinic. It's
We're in a unprecedented time where we're going to see growth just at levels that we've never imagined. Like the rate of change from like the industrial revolution is going to seem infinitely small compared to where things are heading.
no, no, no.
So
I
I think
truly
you're in the right
believe,
industries.
right, traumatic brain injury. I believe spinal cord injuries, all these things are going to start coming into play where we're going to have a game plan, just like, I don't know, like getting your appendix out. Oh, your
Yeah.
spinal cord was damaged. Here's the protocol, you know?
Yeah. And for the longest time, like we've almost evolved to accept death just being the way things are. And we've even evolved to like rationalize it and find the silver lining in death as if it gives life values. And it does. And it helps us cherish and value the time we spend with people like our parents, because we know that one day life will take them away from us. But I think we're entering a place in human evolution where we're realizing that, hey, no, these are things we can control. Like aging is not this one directional thing that is just is. And the primitive ways we've found to live on, like passing on our genes or, creating huge contributions to society and living in the minds of everyone around us, I think we're realizing we might have better tools at our disposal. And I think the conversation of aging and death and longevity is really going to take the forefront of human discourse.
Right, right. And living healthy, and I think healthy is the first key because I talk to my patients and, you know, the last day my father was in the hospital was the day he was born. And he went 82 years without ever being in the hospital ever
Wow,
again. And, hadn't seen a doctor in over 60 years, which is hard to believe since he's got two sons who are doctors, but,
that's
but,
crazy.
he lived a healthy life. And so that should be everybody's goal.
Amen to everyone. That should be the case.
Yeah. Well, have
Thank
a
you for
good
your
night.
time,
Thanks
doctor.
for having me on.